Here's what to expect when being placed on hospice for end-stage CHF. Once again, I know these topics are scary to talk about, but from my experience, the more we learn about the diseases we are living with and dying from, the better we can advocate for ourselves and for our family members. So what does CHF stand for? It stands for Congestive Heart Failure. Now, you can live a long life with congestive heart failure. And just because you have that does not necessarily mean you have to worry about dying from it someday. By the time you're on hospice, it's very, very end stage. So you've likely been living with this for 10, 15, 20 years. The way you decline with this disease, instead of it being a steep slope, like some kind of metastatic cancer when you're coming onto hospice, it's the stairway. You are plateauing out here, you're living your life with this disease, probably having some symptoms, but not a lot. And then suddenly you have an exacerbation or something happens where it gets worse for whatever reason, and you go downhill. And you usually end up in the hospital. Now in the hospital, sometimes if it's been years, they'll say, we've done everything we possibly can do. We think it's time for hospice. So you'll go on hospice when you're down here. And sometimes you may stay down there. But a lot of times with CHF, you start crawling back up and then you plateau, maybe not up here where you were, but down here. And then you actually can come off hospice because you're no longer down here. You haven't declined over the past 6 months. You've actually gotten better. And that is why chronic terminal illnesses like CHF or COPD or Alzheimer's dementia, you can come off and come on hospice over and over and over again. So there's a different type of decline with this disease because it's a chronic terminal illness. So here are the main symptoms you'll see if you're on hospice, so end-stage CHF, if you're on hospice with CHF. Usually the two main symptoms are shortness of breath and edema, which means swelling. So usually swelling in the legs and feet, making it hard to walk. You'll usually be on some cardiac meds, some diuretics, which helps get that fluid off. Sometimes oxygen, because you can be short of breath, not always all the time, but you'll have intermittent oxygen. And a lot of times we will treat a lot of CHF symptoms with morphine, because if you feel short of breath or you're having pain, just a little bit of morphine can kind of take that edge off so you feel relaxed. So CHF can be caused by many different things. It's a complicated, broad umbrella for cardiac issues. And cardiac issues can happen genetically because of your lifestyle. There's just so many things that could happen that can cause you to have congestive heart failure. And like I said before, it slowly deteriorates over time. It gets worse and worse over time, but you can live with congestive heart failure for many, many years. So here's a few things you can expect if your loved one has CHF and how you can better care for them if you're the one who's caring for them while they're on hospice with this disease. One is you're going to see them kind of up and down. This is definitely a disease where it's like you're gonna have good days and bad days. Some days you're not gonna feel short of breath and the edema or the swelling in the legs will be down. Some weeks you'll have a lot of shortness of breath and a lot of edema in the legs, making it hard for them to function. Walk to the bathroom, get out of bed, they'll be having more pain. So in those times, one, if they're on hospice, you should be calling us and saying, hey, there's been a change in condition. If that's the case, we can change some medications around, hopefully get that fluid off their legs so they can feel less short of breath and have their edema gone so they can function a little better. But again, it's going to be up and down. It just depends on the week, depends on the day. And we can do the best we can to kind of manage those symptoms with medication. And unfortunately, as time goes on, medications can only do so much. So if you're the loved one caring for this person, just know we have to get in the mindset of, are they clean? Are they safe? Are they comfortable? If your loved one is all of those things, you're doing a great job. And if there is a change in condition, you can always call the hospice company so we can see if there's something we can do with the medications to help your loved one feel more comfortable. Thank you so much for listening. Let me know what questions you have on what to expect and what disease you would like me to do next. And don't forget to subscribe for more death and dying information.